Okay, so looking at acute stress disorder, one of the reasons why we spend so much time and put so much content and there's so much detail to looking at the diagnosis of post-traumatic stress disorder, it will also understanding the criteria and the symptoms and how they're defined in post-traumatic stress disorder is helpful in getting your head around acute stress disorder. And so if you go into the criteria, you'll see that how trauma is defined in criteria A, how traumatic experience is defined, is almost word for word similar um, to post-traumatic stress disorder. And then you'll see B through uh, C and D. It's a little bit more, it's less broken out in terms of detail, but it's very, very similar. Um, and so the hallmark of acute stress disorder is that the symptom criteria, which is very close to PTSD, is will manifest itself after 3 days, but but it is meant to represent these symptoms as only lasting for a month. So, particularly, and this would be uh, logically more connected, acute stress disorder be more connected to um, a singular traumatic event rather than a series of events over a long period of time, at least in my experience. Now, it's certainly possible that someone, particularly if they're involved in therapy, and traumatic experiences are uncovered, not necessarily like, oh, I had no idea that happened and now it's come to light in my mind, but sort of a level of awareness, but an avoidance of dealing with it. And then they start dealing with it. And all these acute stress disorder symptoms come on. Um, and I think the idea is to help us not immediately go to post traumatic stress disorder, but to recognize that people can have a more of an acute stress reaction, but not necessarily develop PTSD. So if you're working with someone, and again, particularly if you are in an emergency or urgent care setting, this may be more likely, although not necessarily. This can still present itself in an outpatient setting where a serious, unquestionably traumatic event, like as would be described in criteria A, has very recently occurred. And you're seeing PTSD like symptoms, and uh, um, this gives you the opportunity to, like, let's go with acute stress disorder first, and start to apply care and treatment, which in for us as social workers, and really should be for any provider, but should include identifying and garnering supports that are whatever supports are available to that person, and and then not think or talk about PTSD unless these symptoms have persisted for a month. And again, can be really an important distinction, because if someone has a traumatic event anywhere like along the lines of what would be implied in criteria A, as the DSM writes it, if they go put this scenario into a social media platform, or into a even to into a an AI platform, um, they are highly likely to get, at least as far as I can tell, uh, PTSD. PTSD is going to come back to them, and so they may come to you saying they believe they have PTSD, and so helping the your client, if because sometimes it can be helpful to them, like, it's not necessarily PTSD. It is absolutely trauma, terrible trauma, and we need to, I want to offer to continue to work with you through that and help you with these symptoms. And if appropriate, we can talk about referring you for medication evaluation as well to help with manage these symptoms. But we'll start with acute stress disorder if people are very concerned about what the diagnosis is. Um, and then for you, the guidance is that the acute stress disorder is not going to be diagnosed until 3 days after. So I think what the my interpretation, what's written in the DSM, is that accounts for a shock factor, and it is possible, particularly now. This is again maybe more exclusively to a crisis response or an emergent care type of setting that you might be working in, where or certainly some social workers also work as first responders like EMTs, where you may see these things as it's happened or like it's happened minutes or hours ago. Um, and to really just try to get some mental health first aid to that person, um, and not necessarily get into certainly document what you're observing, and to the extent that the person may be able to share with you what they're experiencing, to certainly document that, but not necessarily get into diagnostics, until until this 3 days have occurred. And then if 1 month has passed and these symptoms have persisted, um, then and it's if the symptom profile, what they're saying, what they're sharing in terms of their experience, what you're observing, is looking fits these B through B through C and D in acute stress disorder, then it's appropriate, to look at post-traumatic stress disorder. And I put this in bold in the lecture highlights that I pulled from the book. Um, According to the DSM, according to the research that the DSM authors looked at, about half of individuals who present with acute stress disorder, who meet criteria for acute stress disorder, will develop PTSD. So, so that's something to just keep in the back of your mind as you're doing assessment, particularly with someone who has either recently, and I'll use air quotes, uncovered a trauma, which can mean a number of different things, or that trauma has actually happened very, very recently, meaning within 3 days to a month.